Now, for the next biography, which we are going to grace or look at, is a biography of Dr. Ignacio Ponseti. Dr. Ignacio Ponseti. Okay, so for Dr. Ignacio Ponseti, this is him, and we are trying to look at the biography. So just so you know, he lived between 1914 to 2009, so he was almost 100 years. He died in 2009. So he was a Spanish American orthopedic surgeon. He was best known for developing the revolutionary non-surgical treatment for congenital foot. You can see that right here. He's observing this child's foot to check out for clubfoot. So this new surgery now is called Ponseti Method. You understand? So he developed that. So his early life, he was born on June 3rd, 1914 in Menorca, Balearic Islands in Spain. He was the son of a watchmaker. As a child, he helped to repair a lot of watches, okay, which honed his precision and manual dexterity. If you grew up repairing things, if you become a surgeon, you also be precise. So later on, you can use that skills to be very good surgeon. Yeah, that's cool. So education, he studied biology and also medicine, all at the University of Barcelona, and his overall graduation was 1936. So his career beginning was under Spanish Civil War, that's between 1936 to 1939. He served 3 years as a medic. He treated a lot of soldiers. Okay. After the war, he left Spain, moved to the US. In 1941, he joined the University of Iowa to complete his residency. So that's to tell you that he probably started his residency in Spain, but completed it in US. Then in 1944, he became a faculty member at the University of Iowa, that's the Department of Orthopedics. So major contribution is basically the Ponseti method, so to say. He developed a non-surgical treatment where you can use to correct clubfoot in children, which we'll get to talk about it, and this, method is non-surgery, We'll talk about it in details. So just so you know, gentle manipulation of the infant foot, application of a series of plaster casts to gradually correct alignment, followed by bracings to maintain correction. So impact, he avoided any complication of surgery treatment, provided that's the method, it will provide better long-term outcomes in mobility and function. So today, the Ponseti method has helped too many children. So imagine every child should have even known Ponseti, even if you have clubfoot or not. Because in every community you see children with clubfoot. So it's somebody that is supposed to be talked about more than what we are doing. So later life, he continued teaching and practicing at the University of Iowa for decades. His method gained worldwide recognition in the late 20th century, leading to the establishment of the Ponseti International Association to train doctors globally on how to use the Ponseti method, because clubfoot is actually something much more common to us. He died in 2009. Just like I said, he was almost 100 years, that's at 95 years. And his legacy has helped a lot of children walk normally, even though they had clubfoot earlier. Do you understand? It was corrected and they walked again.